Hello and welcome to the Cliffs Notes version of the pre-op joint replacement class at St. John's. I'm Jordan, the orthopedic program manager here, and I'm joined by
Dr. Andrew Young, orthopedic surgeon over at St. John's, and we're so glad you joined us today. And we just hope to condense all the material to 10 minutes or less. We know you're busy.
So you can refer back to the booklet that you got in the office if you have any questions about further information, but this should go over the highlights of things. So we'll go ahead and get started here. Before your surgery, it's important to get yourself as prepared as possible. You should have an appointment with your internist or your primary care physician at least 2 weeks before your surgery. And it's always a good idea to think ahead and have some help at home for the first couple of weeks. You don't need help 24 hours a day, 7 days a week. Just for a couple of hours for the first week or two should suffice. It's also really important that you make sure you review your insurance policies. You know what any co-payments are to you. You might get a call from the hospital billing department a week before the surgery as well. And if you're the person who does the grocery shopping before or at home, make sure that you make a stop at the store before your surgery and stock up on things and have some meals prepared so that you don't have to struggle in the kitchen with a walker or a cane.
Yeah, and just take advantage of the time before surgery to prepare. Patients are prepared, just tend to do much better. They have a much easier time because their expectations have been managed.
And just listening to this class already puts you ahead of the game because you're getting prepared by watching this. So thank you. It's really important that you bring us an up-to-date list of your medications. You can bring that to the hospital with you, have it written out with the name of the medication, the dose, and the frequency that you take it. We don't want you to bring any medications to the hospital unless you take certain medications, things that are really unusual that you've had to special order from your pharmacy, things that are crucial or life-dependent, something that's really expensive, or if you've had something compounded and made especially for you, or if you take a name brand of a medication and you can't take the generic form, please bring those in. Otherwise, leave everything at home. We've got 99.9% of most medications here at the hospital.
Preparing this list ahead of time will make your hospital stay so much easier. The nurses will ask you about the medication. I'll ask you about the medication. The pharmacist will ask you about the medication. If you can just refer to the sheet and not have to memorize all your medications, you'll be a lot happier.
When you're at the hospital, fall prevention is a big part of the nursing process here. We want to make sure that you don't fall. Your safety is our first priority. So our motto is call, don't fall. We ask that you call us to get up if you need to until physical therapy has told you that you are cleared to get up on your own. So we'll make sure you have your call light nearby that you can reach us with. You'll also have your personal items at the bedside like your cell phone, and we'll make sure that your room is nice and clean so that there's nothing that will trip you up like cords on the floor or laundry hanging off of your bed. So the bottom line is here, we just want to help you out. Let us help you to the bathroom. Let us help you walk down the hall. Call us if you need anything.
Yes, and safety again is the biggest concern. So the therapist will teach you how to move safely. They'll focus on balance. And again, the whole team is here. So if you feel uncertain, if you don't feel stable, just reach out. Everybody is there to help, and it's just a natural thing.
Pain control is also another really important part of the healing process. We want to make sure that you're able to get up and move around, and keeping good control of your pain is crucial to that. So we use a 0 to 10 pain scale. 0 is no pain, 10 is the worst pain possible. And our goal is to keep you at the most around a 3 or a 4 out of 10 on that scale. And the way that we do this is staying on top of the pain medication. And you'll discuss your pain regimen with your nurse and what works best for you. And it's also really important that you medicate prior to physical therapy. So about 1 hour before physical therapy is scheduled to work with you, that's the best time to take pain medicine. That goes for when you're in the hospital as well as for when you're at home.
Yeah, and just take 10 seconds now, pause, and get used to this scale, because this is the way we communicate to each other about your level of pain. So again, 0 to 10, happy face, sad face, and we'll just ask you to point or put a number, and then that will be the pain number in your chart.
It's not unusual after surgery, like a hip or a knee replacement, to experience some odd sensations in your surgical leg. So swelling is very normal after surgery, and you might feel like your leg's a little bit heavier because of that excess fluid, and it might feel tighter. If you're having your knee done, you might feel like there's a band around your knee. Not unusual also to feel like your leg's a little bit longer after surgery. You might have warmth and redness around your incision site, all part of the inflammatory process. There might be some numbness around the incision site. After we cut skin and nerves, that's normal. And then you're going to have some bruising show up after surgery, and it usually gets worse around 2 weeks, and then it'll start to go away eventually.
And it's just important to know that All these symptoms and sensations are normal. They're a necessary part of the recovery and healing process, and they typically pass.
Physical therapy will see you for the first session on your day of surgery, and then every subsequent day after that, they'll see you twice a day, and occupational therapy will see you once a day. Physical therapy is going to be really a big part of your healing process, though, because they're going to work on a lot of the functional things that you need to do in order to get home. So they're going to work on walking with you first and foremost. They're going to work on balance. They're going to work on stairs and transfers with you. So getting in and out of bed and up and down from chairs, which is really important for you.
And here is where preparation is so important. So in terms of physical therapy, take the time to prepare before surgery, whether that means visiting your local physical therapist with the prescription we give you, or attending Jordan's class in person and then working with a physical therapist, or just going through the videos over and over again of Christy and the physical therapist teaching you how to do stairs, balance, and transfers. But take that time to learn how to do your exercises so as soon as we're done, we can get you moving.
After surgery, it's not unusual to experience constipation after you were under anesthesia and then you're taking pain medication. You're not moving around as much as you normally do. Constipation happens to the best of us. So some dietary recommendations that we would suggest would be eating foods that are high in fiber, like fruits and veggies, whole grains. Drinking 6 to 8 glasses of water a day will help to keep things moving as well, because our goal is to keep you from going more than 3 days without having a bowel movement. So it's really important when you're taking narcotic pain medication to take a stool softener, have that on hand before surgery so you're ready to go after. And then if you get to that 3-day mark and the stool softener is not doing what it's supposed to do, you might need something a little bit stronger. So it's always a good idea to have those things on hand before surgery. Taking care of your incision at home is really important because infections are the number one complication of any joint replacement surgery. So we want you to keep your incision as clean and dry as possible. You'll have a great dressing on there that's sealed on all 4 sides that will help to keep it clean and dry, but you got to keep it clean and dry yourself too. So keep your wound out of the water. You don't want to be submerged in water. We don't want to scrub or rub it or put any ointments or creams over the incision site. Clean and dry is key. We'll assess your incision when you come back for your follow-up appointment, and we will let you know if you're safe to be submerged in water and if you can put anything for scarring on top of the incision.
So our nurses will take down your dressing and then assess the incision and then put a clean, dry, fresh incision the day after surgery. And again, that's a special, highly technical dressing that can stay on for a week. It's water resistant. You don't have to do anything. And there's a very nice video on Incision Care that Olivia made. So if you have any questions about that, just refer to that video.
When it's time for you to go home, that's your day of discharge. There's a couple of things that need to be in order before we can let you go. So physical therapy will clear you and make sure that you're functionally safe to go home. Case management will also see you. They'll make sure that you have any home health needs set up. So if it's going to be PT or nursing, they'll make sure that's ready to go before you leave. We also like to get your medications filled at the pharmacy nearby. We can fax it over to them. They'll deliver it to your bedside, and they'll take a form of payment if you do have anything due. We will change your dressing if it's not already changed that morning, and we will give you extra dressing to go home with just in case you need it. And if you have a dose of pain medication due, we will give that to you. We just have to monitor you for about an hour afterwards, so keep that in mind.
So we want to make sure that all the criteria for safety and self-management have been met. There's actually another video that just focuses on how the discharge process is made, so you're welcome to refer to that. That actual discharge process takes time because we have to organize the information and the medications to make sure that you will do well once you get home. So please be patient on those final couple of hours as we prepare you for discharge home.
When you leave the hospital, you'll get really detailed instructions on what to look out for as far as signs of infection or signs of a blood clot. But the big things we're looking for are fever over 101.5 or higher, anything draining or oozing out of your incision site, and the signs and symptoms of a urinary tract infection should be in your mind because that's always a possibility. So keep those things in mind.
And while these are all possible, they are all extremely rare. Your joint will be red, hot, warm, and swollen. But remember, that's a necessary part of healing. That's inflammation, and it is not infection. So keep on the eye. your eye on the lookout for unusual symptoms like temperatures over 101.5. But remember, redness and heat and warmth are just a normal part of recovery.
So that about wraps it up for our Cliff Notes version of the pre-op joint replacement class. Thank you for joining us. If you want to watch the full-length version, you're more than welcome to. There's a little bit more in-depth information, but this should give you the highlights of what to expect.
And again, also read through the book. There's so much value in preparing ahead of time. It's going to be an important roadmap that just makes everything a lot easier for you.
We'll see you here soon for your surgery.